Thank you, Steve. I want to first start my talk today just talking about what CDC currently is doing in the area of violence and violence prevention research and programming, just as a basis of sort of where we might go from here, and also although the slide listed me as director of the Center for Gun Policy and Research, I'm also Deputy Director of the Center for the Prevention of Youth Violence at Johns Hopkins, which is CDC funded. So this slide just represents the areas. I hope I'm not missing anyone's Linda sitting right in front of me here. Child maltreatment, dating violence and intimate partner violence, sexual assault, elder abuse, suicide, youth violence, as Nina referred to, the National Violent Death Reporting System, active in 18 states. Very broadly, if you look at the activities underway at CDC, a lot of really valuable work being done. The sort of theme that one probably could see in careful examination is a great focus on primary prevention, the idea of stopping violence before it starts, of sort of a developmental orientation of sort of human development, as well as appreciation sort of links of violence and community factors. What I'd like to suggest, and I think maybe is sort of part of the reason that we're here, is while these activities are incredibly valuable and teaching us about violence and its prevention, currently there's insufficient connection to the most severe forms of violence, lethal outcomes, and that, of course, is where firearms come into play. There are some exceptions. Under the Academic Centers of Excellence in Youth Violence Prevention, I've been fortunate at our center at Johns Hopkins to be able to study a replication of a ceasefire community public health program to reduce gun violence in urban neighborhoods. We did find significant reductions in both non-fatal and fatal gun violence in most but not all the intervention sites that we studied. There's also been prior research from Chicago showing similar effects of reductions in most but not all settings. And I think because there's so relatively little public health activity on pure public health models applied to gun violence, that we should need to learn more about the best implementation practices for this type of intervention, and I'll come back to that in just a minute. We also found in this research that the conflict mediations done by violence interrupters were quite key in reducing gun violence. As I indicated, of course, the most direct way that CDC is looking at the lethal continuum is through its violent death reporting system. While I echo Nina's thoughts about expansion, I would almost just as well see more depth to that reporting system to tell us more in more detail what's going on with those violent deaths, particularly with respect to how guns are getting into the hands of the perpetrators. Now I'm just going to very, very briefly summarize some points in gun policy research. Of course, I don't have the time to cover the whole spectrum of all the research on gun policy, but I want to just note a few things. I believe Phil Cook alluded to, just with respect to private sales background checks, that there is some research showing that those policies are associated with fewer diversions of guns to criminals. There's actually a much broader body of research, several studies now that very consistently show whether we're talking about state policies, enforcement interventions, or litigation approaches, generally where there are focused efforts to have greater accountability on firearm sellers, you have far fewer guns diverted to criminals. it's been a little bit of disappointment to me that I think the importance of this has not been fully appreciated because it doesn't have the nice public health outcome of fewer deaths or fewer people shot. But I think it's the most direct link to these policies that their design is to keep guns from being diverted to criminals and high-risk individuals. And while I agree with Phil's suggestion about the need to study state policies and their effects, I think we have to acknowledge, as I think Nina did, that there's sort of a pattern here of variety of gun policies in place, and the weaknesses in certain states' laws limit the ability to have full impact if we were to do this on a national scale. So I just wanted to mention that point. But the most important needs going forward, I think, is we've made relatively good use of the trace data that has been available, and we need greater access to that raw data now. But we need to know more about how offenders access alternatives to those initial new guns coming directly from the licensed gun dealers. How do criminals access interstate traffickers, the internet, theft, and older guns available from street sources. And what I think would be incredibly valuable is to examine differences in street prices for guns in different environments based upon the regulatory and enforcement efforts in those localities. And not just the street price, but even measures of the difficulty of acquiring firearms, not just in how much money, but how much time and risk one has to undertake. What do we know about gun control effects on violence? Again, I can't cover the water here. I do want to mention that maybe the most fundamental thing when people think about gun policy, gun control, is there's a set of individuals that we think might be too risky to have guns, and so we're going to have prohibitions on there. So there is research that led by Garen Wintemute on violent misdemeanors showing beneficial effects of those policies, as well as individuals subject to domestic violence restraining orders, and recent work by Jeff Swanson looking at policies to keep guns from the severely mentally ill. I've also led research looking at junk gun bans, showing some effects, reducing gun homicides in Maryland, reductions in teen suicides from child access prevention laws, and probably the most well-studied policy is right to carry laws. For my money, the best careful analysis of this finds little effect, if any, and if so, it's in the direction of harmful effects. But what are the weaknesses in the current gun policy evaluations? I think many, if you look at the studies, many of them are based upon statistical approaches with very questionable assumptions. Maybe most important for me is always the timing of the effects. Most of the studies assume that the minute a law becomes effective by law, it's going to have its full impact on reducing gun homicide. I think that's a very, very unrealistic assumption that clearly biases any estimate towards the null. Perhaps less important, but I think worthy of examination, is many of these models assume that independence of one policy's effect has nothing to do with the presence of other potentially complementary policies being in place. And again, if we think carefully about how gun regulation needs to work, you need a complementary set of policies that are going to be most effective. And then the other important issue, of course, and this is our biggest challenge that was alluded to earlier, is they assume that unmeasured confounders are in essence equal when you have the states that adopting the most restrictive laws are, of course, quite different in important ways from those that don't adopt those laws and might have the weakest gun regulations in place. We also, this research has not really, in most cases, sort of looked at specific subgroups of interest. It may well be that, for example, those who are very connected to criminal enterprises are able, without too much difficulty, to get around the laws, identify interstate sources or other means, whereas other high-risk individuals are less able to in essence, get around the law. So I think it's worth examining effects on very specific subgroups of interest. Finally, some of the weaknesses in the research on this, frankly, has to do with the weaknesses in the policies examined. As Phil Cook explained in a chapter he wrote for a book that we recently published, the Brady Law had, as necessary as it was from where we were when it was passed, there's obviously huge gaps in there, and we probably shouldn't expect huge impacts from a relatively weak law. And there's also many times policies ignored. And I think the policies most commonly ignored is basically how many people are being screened out. There are big differences across states in how broad the prohibitions are. So switching gears from the broader legislative policies and what we know about them and what we need to know more about, if forced to identify a single strategy that is most focused on reducing at least urban gun violence, you might look towards this idea of focused deterrence or pulling levers. Nice review done recently by Anthony Braga. Basically, the program model, very briefly, identify the most risky individuals out in a community, have heightened surveillance, federal penalties, communicate the heightened risk to those individuals directly. As this model sort of has evolved over time, I think we're seeing greater focus on the importance of not just relying upon the criminal justice formal control system, but also complementarily informal social controls. These interventions commonly also offer alternatives to getting out of a lifestyle of violence. 7 out of 8 studies found this strategy to reduce violence. Why am I mentioning a largely criminal justice type of what many people think of as a largely criminal justice intervention? The direction I'd like folks to consider for public health is to think of what are natural ways in which public health complements criminal justice approaches to reducing gun violence. I would like the committee to consider CDC developing testing programs that complement law enforcement efforts to keep guns from high-risk people and deter violence. This might involve something like outreach or education to potential straw purchasers. I'm going to jump down to the last one. I'm going to go slightly out of order of my slide here. What I find it to be a very compelling model, there's a body of research from community interventions to reduce alcohol-related injury and violence. Much of this work is probably at least 15 years old. But what I find very compelling about that is the multi-pronged strategy in which these interventions try to address a complicated problem. They involve community mobilization to prevent irresponsible alcohol sales and practices and alcohol abuse, address problem outlets, train sales staff, and increase enforcement and raise public awareness. You could probably, I think, substitute guns for alcohol here and have a reasonable starting place for thinking about broad community interventions that have partnerships between community members, public health, and law enforcement to address the problem. And then the last thing I'll mention relevant to this is the models of violence interruption that comes from the program Ceasefire in Chicago that we've successfully replicated in Baltimore, I think are very useful, but relatively expensive, and I think we need to think about lower cost ways to expand that model. And so here are my final three. I just hit the red light, so I'm just going to, here are my priorities that somewhat are reiterating what I said before. We need in-depth studies of how offenders obtain guns, as well as the backgrounds of buyers who are supplying those individuals. We need multi-layers evaluations of gun sales regulations to assess effects on availability and use of guns by high-risk groups. And we need to develop and test new community interventions to reduce availability and use of guns. Okay.
Thank you, Daniel. Our next speaker is Greg Ridgway, and your bio says acting. Are you now no longer acting? Or are you still acting?
Still acting.
He's still an actor, the acting director of the National Institute of Justice.